The loss of just one specialist, for instance a surgeon or cardiologist, can have huge impact on health service delivery, putting the lives of many people at risk. This is especially so in the referral hospitals, where most specialist cases end up.
The Mulago Hospital has also lost about 40 specialists within the last 2 financial years. And a lot of these have left and they've joined the universities, or have left the country and left entirely the country, gone to Rwanda, gone to South Sudan. Others have joined NGOs, they've joined UN organizations. They are desk officers instead of handling patients.
Government has tried to improve the working conditions of health workers, but there is still a lot to be done. Government recently released 50 billion shillings to enhance the pay for doctors at lower health centers, mainly in rural areas. President of the Uganda Medical Association, Dr. Margaret Mungerera, says they are vigorously lobbying government for 40 billion shillings to cover up other medical cadres to improve the working conditions in an effort to contain the massive brain drain.
You need something like 43 billion shillings added onto the wage bill to be able to cover the other 4 cadres of staff. Now, if that is too much, we will at least pick up 1 cadre, and that we think should be the senior midwife.
Dr. Mungerera, who is also the president of the World Medical Association, says the doctors who are leaving for better pay don't actually need too much, since their main preoccupation is saving life. Teachers have also been crying out to government to improve their pay, but without much success. Dr. Margaret does not have hope that they will achieve the 100% increment demanded. She cites the Turiamuhika report drafted in the 1980s to streamline the salary scale for civil servants.
The Ministry of Public Service did a job evaluation. In 2000, it launched the report and recommended that we change from the multiple spine, where we're all in our own separate salary schedules, and that we change to the single spine. And this approach has been pushed by the World Bank and IMF. They've been pushing countries to adopt this single spine salary structure because it is easier to manage the payrolls.
Meanwhile, the Ministry of Health has held the second National Quality Improvement Conference under the theme, Evidence-Based Improvements in Health Care. Here, stakeholders meet to assess the core aspects of the country's health sector and what has been done to improve it. Minister of Health, Dr. Ruhakana Rugunda, who officiated at the event, was optimistic that the recently unveiled budgetary allocation to the health sector will have an impact. This, even when the 7% share is far below the 15% that Uganda and other African countries ratified in the Abuja Declaration.
We would like more. But we also realize that we need very good infrastructure in order to build the economy. Hence, we fully support the increased amount of money put for infrastructure development.
Zahra Namuli, NBS Television.